Hello, dear friends. I will tell you today about a study that proved for the first time in the world that it is possible to reverse a person's biological age. This study was published in 2019 and made a lot of noise in the scientific world. It was the first study that reliably found out that 9 men between the ages of 51 and 65 became 2.5 years younger 1 year after the experiment. I will give you the details of how they did it, who conducted the study, and why it was possible in the first place. It all started in 1986 when Gregory Empfehen read a paper that growth hormone used in dogs and rats restored the lymphatic organ function, thus known as the thymus gland. Then, this restoration of thymus gland function defeated age-related immunosuppression and rejuvenated the immune system. He wondered why not perform this experiment on humans. In the early 2000s, he did such an experiment on himself. He injected himself with growth hormone for 1 month. Before starting this experiment, he had an MRI of the thymus gland. This organ is located behind the sternum. After injecting himself with growth hormone for a month, he saw on the MRI scan that his thymus had enlarged, and the amount of fatty tissue in it had decreased. He hypothesized that restoring thymus function could be used to combat age-related changes in the body. The thymus is an organ that is very active in the child in the fetal period, and then in early childhood, the thymus is needed for the maturation of lymphocytes. Lymphocytes are cells of our immune system produced in the bone marrow. They are not mature lymphocytes. Then they get to the thymus. In the thymus, they undergo maturation. Since they are in the thymus, they get what is called immunological tolerance. That is, they learn to recognize foreign things and not to touch their tissues, to be aggressive to foreign tissues. People whose system of recognition of their own and others' tissues is disturbed have autoimmune diseases, such as systemic lupus erythematosus, autoimmune thyroiditis, psoriasis, Bechtereau's disease, many rheumatic diseases, etc. And one of the causes of aging is the impaired function of the immune system. At the age of 60 to 65 years, people most often have deviations in the immune system. Autoimmune diseases may develop, lymphocytes begin to age, and the immune system stops recognizing cancer cells, resulting in impaired anti-tumor protection and aggravation of chronic systemic inflammation. All this corresponds to the immune theory of aging, where our immune system and bodies age. This study was designed to investigate what will happen if we renew and rejuvenate the immune system and whether it will cause renewal and rejuvenation of the whole organism. So, how can one determine whether a person is aging or getting younger? External data such as wrinkles, gait, and so on are insufficient because wrinkles or skin properties can be easily corrected. You can go to cosmetologists or plastic surgeons and they will quickly fix everything. Internal organs do not always reflect a person's age either. Blood tests are not an indicator of age either. To determine the exact age of a person, another scientist, Steve Howard, invented the so-called epigenetic clock. Epigenetic clocks make it possible to determine a person's biological age. How does it work? We all know that the primary structure of DNA consists of 4 nitrogenous bases: adenine, thymine, cytosine, and guanine. And here's the curious thing. The cytosine molecule can undergo methylation, meaning that a methane residue, a CH3 methyl group, can attach to the cytosine molecule. Interestingly, a newborn has 0 of these methyl groups attached to cytosine. The older a person gets, the more methyl groups are on his DNA. Consequently, the higher the degree of DNA methylation, the older the person. During the experiment, 9 people aged 51 to 65 were recruited. They were assigned a specific program for a whole year. The men were supposed to be injected 3 or 4 times a week with the somatotropic hormone, somatotropin, at a dose of 0.015 milligrams per kilogram of weight. In addition, 2 other drugs were prescribed: dihydroepiandrosterone sulfate, 50 milligrams, which was to be taken daily, and metformin 500 milligrams, which was also to be taken daily. Why were the medications prescribed? First, growth hormones can cause a predisposition to diabetes in some people. Second, it causes insulin resistance. To avoid the adverse effects of growth hormone, dehydroepiandrosterone sulfate was prescribed because dehydroepiandrosterone sulfate increases tissue sensitivity to insulin. The second drug, metformin, is also prescribed to protect against the possible diabetogenic effects of growth hormone, since metformin reduces blood glucose levels and makes cells more sensitive to insulin. Along with these three main medications, all the men received 3,000 international units of vitamin D and 50 milligrams of zinc daily. Before the study began, all of these men had a thymus gland MRI, and after the study ended 1 year later, they also had an MRI scans of the thymus. Blood samples, saliva samples, and other biological materials were also taken from all of them. After a year, it became clear that the thymus gland tissue was restored in all subjects without exception. That is, the percentage of living thymus tissue increased. The thymus itself had increased in volume. It was the first significant finding. Before the experiment, people also determined their biological age using epigenetic clocks and did the same immediately after the end of the experimental period. And what did researchers find out? They expected that at least the biological clock would slow down, but it turned out that the average biological age of all people became less by 1.5 years from the initial one. That is, during the year of the experiment, people not only did not age, but they also became younger by 1.5 years from the original. It was a stunning result. The somatotropic hormones dihydroepiandrosterone sulfate and metformin reduce people's biological age by 2.5 years over a year. So what mechanisms might be responsible for this lowering of biological age? We began to examine blood tests and found that as the thymus regenerated, this entailed restoration of T lymphocyte function. T lymphocytes, particularly T killers, are the cells that have antiviral defenses, and these cells were significantly more active in people a year after the use of these drugs. The second component is a change in the ratio of lymphocytes to monocytes in the general blood count. The lymphocyte to monocyte ratio should be at least 5. I'm referring to absolute numbers. If this ratio is below 5, many studies have already shown an association with cancer, depression, aging, and chronic inflammation. This index improved radically in all subjects. They also examined the amount of CD38 receptors on the surface of monocytes, the so-called differentiation cluster. This is an enzyme that cleaves nicotinamide adenine dinucleotide and prevents the formation of nicotinamide adenine dinucleotide from nicotinamide mononucleotide. The effect of nicotinamide adenine dinucleotide on sirtuin and old age can be described as follows. The more of the substance supranicotinamide adenine dinucleotide in the organism, the younger the organism is. A year later, it was found that the number of enzymes that destroy nicotinamide adenine dinucleotide in these people has significantly decreased, and the amount of available nicotinamide adenine dinucleotide has increased. Subjects also became biologically younger. Therefore, the effects of these drugs in the age reversal experiment can be explained as follows. When the thymus was restored, the immune system cells began to perform their functions better. The relationship between lymphocytes and monocytes also improved. It is also an excellent prognostic signal. The third is that we can indirectly assume that the amount of available nicotinamide adenine dinucleotide, which has the youth reversion effect, increased in the body. Of course, critics may say that the study is small. There were only 9 people studied and no control group. But overall, this study set a precedent. For the first time in the world, the possibility of regaining youth, of age reversal, has been proven, and it has been proven at the level of the biological clock. So this study gives us hope that there are ways of approach that can help us, at least slow down the aging process. The scientists who have conducted the research hope that shortly these studies will take on a more large-scale basis and will be controlled. They intend to include not only men but also women of different ages and social groups. It will help to control to what extent these results can be reproduced and to what degree they can be trusted. In conclusion, I would like to say that I'm not urging you to buy somatotropin right away, that is, to inject yourself with growth hormone, because it is simply too early to conclude. And about growth hormones, I want to warn you that I am against using growth hormones by healthy people who do not have hormonal disorders, although many internet bloggers, apparently without medical education, talk about it. To imagine all these side effects and generally the interactions of the somatotropic hormone with other hormones and biological processes in our body, you need to have the mind of a grandmaster and imagine the multiple combinations that this hormone can have not only at the macro level but also inside the cell. Growth hormone has been linked to the onset of diabetes, and while growth hormone is perfect at melting body fat, think about where that fat goes. Roughly speaking, it all settles on the blood vessels. In a study of blood vessels in people who look fine, younger than their age, because growth hormone also stimulates collagen synthesis, and the skin becomes tighter, young for their age, nevertheless there were many atherosclerotic lesions and plaques inside. That in itself is a risk factor. It's all pretty on the outside, not so much on the inside. Plus, it also has an oncogenic potential. Any hormone that stimulates anabolic processes always raises doubts, whether it will not cause or whether it will not provoke any tumors sitting in the embryo. That's why I've always emphasized you should be very careful with growth hormones. Always for you, Dr. PopMed.